One deadly drug that we've seen involved in an increasing number of overdoses is fentanyl. And there is a new kind to be wary of.
Yeah, our 9 Health expert, Dr. Pyle Coley, joins us this morning to talk about rainbow fentanyl. This is all over the news lately. So many people are talking about it. Parents are really concerned about it. So are you seeing this show up here in Colorado?
Yeah, we are seeing this, Corey and Gary, and it's really concerning because it looks like candy, just as we were talking about. Looks just like sweet tarts. It can also come in powders. It can come in blocks looking like sidewalk chalk. And this is intentional. The idea here is to make it look fun, make it look innocuous. And we know that fentanyl is a synthetic opioid that's 50 to 100 times more potent than heroin. It's 100 times as potent as morphine, and it's very, very addictive. So you just have a little taste of it. It can lead to either addiction or, in the worst case scenario, unintentional overdose.
Yeah, those pictures we're looking at, I mean, it really does just look like candy.
Yeah.
You know?
Yeah.
Oh my goodness.
And that's why it's even more concerning for parents, because it looks like, as a parent myself, my kids will see anything that looks like candy and put it in their mouth, which is so scary.
So true. So the younger kids, we get those unintentional overdoses. The adolescents may think it's benign, but even for me as a physician, it's really concerning because this new type of fentanyl, we don't know what type of fentanyl it is. We don't know what the concentrations of fentanyl are in each of those substances. So if a child, adolescent, or adult comes in with an overdose, of course you give them Narcan, but you don't really know what you're dealing with.
Right.
Now, thankfully, the city of Denver does have a free program where you can write in on the website and actually get fentanyl test strips. So, you know, this is a great conversation for parents to have with their teenagers, to educate them that if they're ever going to take any types of pills, where they might think it might be Adderall or something else to help them study, especially our kids in college, get some of these strips and make sure that they're not laced with fentanyl.
What are the warning signs if somebody is overdosing? What should parents be looking out for?
So, you know, of course, it creates that dopamine release, which gives us that high. But what it also does is it binds to the receptors that affect our breathing. So there's a classic triad, 3 things that are classic for fentanyl or any kind of opioid overdose. The first is pinpoint pupils. So you look at the black part of the eye, and if it's like the tip of a pencil, a pinpoint, it's constricted. That's a sign that there may be an opioid involved. Respiratory depression. So if their breathing is either slowed or stopped, that's a very classic sign of opioid overdose. And then finally, level of consciousness. If they're confused, altered, not waking up, they look really sleepy or tired, those are all signs. You got to call 911 right away because their brain's not getting oxygen, and you got to get that Narcan into them.
It's so scary. There's a video that's going viral this week on TikTok and Instagram of a nurse who says that she is seeing this every single day, multiple times a day in her shift. And she's saying, you know, as a parent, you just need to have Narcan on hand and you need to know those warning signs.
Absolutely. And unfortunately, what we've seen is that the pandemic has really catapulted these numbers into a whole different category. So we're seeing an 80% increase in drug overdose deaths related to synthetic opioids like fentanyl as a result of the pandemic. And overall, we know that this is probably one of the largest public health problems that we're facing as a country.
I was going to say, we've been talking about this for a couple of years now, and it doesn't seem to be having a huge impact yet.
No, in fact, it seems to be heading in the opposite direction. And that's why I think education, and the problem is that there's no regulation, of course, of, you know, these types of substances, how they're made. So it's up to us as members of the community, I think, to educate ourselves, our family, our children. And as you said, Corey, be prepared. You know, have Narcan on hand if you think someone might be at high risk.
And again, you pointed out that if you feel like someone has overdosed, you call 911 and you give the Narcan. You don't do one or the other. It's both.
That's right. And you want probably position them onto their side so that if they're vomiting it or anything like that, they don't aspirate on that vomitus and it just kind of goes off to the side, and try to stimulate them as much as possible to kind of reverse some of those effects.
Scary stuff. Dr. Coley, thank you. Appreciate it.